Coming.
Hey, Nick, how's it going? How about that right there? There we go.
All right.
All right.
What's up, Doc?
I'm Dr. Jones. Tell me what some of your symptoms are. Let me hear.
Today's patient's name is Nick Harth. He has Myasthenia Gravis. Let's learn more.
So recently I've been whenever I'm just studying or whatever, my vision kind of doubles, where I'm looking at it and the picture just kind of comes together. And also my hands are starting to become sore. And I've had shortness of breath, but I know it's COVID times, but I don't think it's COVID. I don't have a fever or a cough or anything like that.
Okay. I mean, my first instinct is that you probably have Myasthenia Gravis. Basically what that is it's a chronic autoimmune neuromuscular disease. Sometimes it's caused by an error in the transmission of nerve impulses to the muscle. It can also occur when normal communication between the nerve and the muscle is interrupted at a neuromuscular junction. And basically what that is that's just a place where nerve cells connect with the muscles that they control. Normally, when electrical signals or impulses travel down a motor nerve, the nerve endings release a neurotransmitter. That neurotransmitter is called acetylcholine. So basically what that does is that binds to sites called acetylcholine receptors, which are on the muscles. The binding of acetylcholine to its receptor activates the muscles and causes the muscle to contract. And in myasthenia gravis, which is what I think you have, the antibodies, which are immune proteins produced by the body's immune system, they block, alter, or destroy the receptors for acetylcholine at the neuromuscular junction, and then that prevents the muscles from contracting, which is why you're not being able to move. So this is most often caused by antibodies to the acetylcholine receptor itself, but antibodies to other proteins like MuSK, which is just muscle-specific kinase proteins, they can also impair transmission at the neuromuscular junction. So I think what I'm going to do is have you get a blood test. So what a blood test is going to do is that's going to look for abnormally elevated levels of your acetylcholine receptor antibodies, okay? They can also detect a second antibody, which is called the anti-MuSK antibody, which I just talked about. It's been found in about half of individuals with myasthenia gravis who do not have acetylcholine receptor antibodies. All right, so why don't we go get you a blood test, okay?
Yeah,
all right,
sounds good.
6.5 hours later.
Coming.
Hey, what's up, Nick? It's just me.
What's up, Doc?
All right, so I got your blood test right here. Your blood is not pretty, okay? So basically what that means is that you have abnormally high levels of antibodies in your blood, okay? And that indicates that there was an error in your acetylcholine receptors. So what we're gonna do now is we're gonna get you a biopsy of your thalamus. And what that is, that's a fine needle aspiration that removes a sample of cells to look for more abnormalities. And basically the kind of abnormalities that we're looking for are clumps of immune cells or just a tumor in general, okay? All right, let's go get it done.
Sounds bad.
Hey, Mr. Harth, how are you? So we'll be performing a small, fine aspiration incision on you today to check out your thymus. Heard you've been having some problems.
I'm gonna die.
Let me just grab my utensil real quick. Oh, perfect. Alright, don't worry, just a little small. Ow. Alright, Nick, so after the biopsy, it looks like there were some clumps of immune cells in your thymus. They were benign though, luckily, so they aren't cancerous. So there really is no rush to remove your thymus. We are going to want to get removed though, just in case, because there has been some research that it develops some immune cells causing the immune system to produce acetylcholine receptor antibodies, which set the stage for the neuromuscular disease that you've been diagnosed with. But so we'll set that aside for now. Though we'll reschedule your surgery for later because it's not too important. Don't worry about it. Okay.
Nick eventually got the surgery, and to this day, he's doing as good as ever.
Come in, Doc.
Yeah, oh my goodness, look at you. I'm Dr. Jones. Mike, what seems to be the problem?
Our second patient's name is Mike Fleming. His condition is even more advanced than the last. Let's take a look.
I think I had a stroke or something. Like my eyes been real droopy, and I've been having a problem.
I can see that.
Like talking.
Okay.
It's really weird.
Right off the bat, I'm gonna say I had a similar case like this earlier. I'm gonna say you have myasthenia gravis, but I think yours is a little bit more prolonged, so that's probably not that good. I'm just gonna run you through some quick tests. The first one's gonna be muscle strength. All right, can you do me a favor? Just push against my hand. Does that hurt?
Yeah.
Okay. Just gonna check your muscle tone here. Yeah, you do feel a little flabby. We'll do a coordination check real quick. Okay, so just follow my finger. Okay. Okay, so the last test I'm going to do for you, it's called the sense of touch test. All right, just close your eyes. Let me know if you feel this, okay? Did you feel anything?
No, I didn't feel anything.
Okay. All right, so it seems to me like your condition is super advanced. So I'm going to put you on a medication. It's called tacrolimus, okay? It's a capsule. It's taken once a day. I think also what I'm going to do is I'm going to get you a pulmonary function test, okay? That's going to check for myasthenia crisis. That's a medical emergency that occurs when the muscle that controls breathing weakens to the point where individuals actually require a ventilator to help them breathe, okay? So that's serious. That may be triggered by infection, stress, surgery, or even like an adverse reaction to medication, okay? So that's, up to 1/2 of people may have no obvious cause for myasthenia crisis as well, okay? So this will tell us if that's your case. So let's go get that test, all right?
All right, thanks a lot,
Let's go.
Doc. Thanks. How you doing today, sir? I'm Mike Fleming. I'm here for a script.
All right, Mike. Looks like we have a Prograf here for you. Have you had a recent kidney transplant?
No.
Oh, okay. Well, you're going to be taking that. It's going to be a capsule. You're going to take it twice a day. It's going to decrease activity of the immune system. It's technically given after an organ transplantation, so it's a little different. You're not. Be going to a class of medication known as macrolide lactones. They're just immunosuppressants. Just don't eat any grapefruits, all right?
All right. Thanks, Doc.
Yeah, you got it, weirdo.
After taking his medication, Mike's condition stabilized, but unfortunately it could not get better.
I think I had a stroke, Doc. Like my eyes.
Oh, Jesus, look at you. Hey,
Script.
Hi, how are you?
I looked at your eye.
Close your eyes for me. Just let me know if you feel this.
I
Did
didn't feel it.
you feel anything?
No, I didn't feel anything.
All right.